Today we're going to talk about spine health, injury prevention, and treatment. My name is Jamie Riding. I'm a pre-PA student here at Weber State University working on a Bachelor's of Integrated Studies with an emphasis in health studies, health promotion, and health administration. I'm a certified clinical medical assistant, and I've held a license with the Texas Medical Board as a non-certified radiography technician. I have over 10 years of leadership and training experience in the health and hospitality industries. I have experience in inpatient lab, pediatric urgent care, physical medicine and rehabilitation, and orthopedic spine surgical care. Most recently, I worked with Texas Back Institute and Dr. Peter Derman. Dr. Derman is an endoscopic spine surgeon, one of only a handful in the United States. It was while I was working with him that I found my passion for patient care and was inspired to become a physician assistant. Before we get into our training, I'd like everybody to split up into groups of 3. We should have 5 groups. We're going to play a game called Anagrams. At the top of the screen, you'll see a word. You're going to use the letters from that word to create new words. The first team to reach 5 words will win. All right, let's get started. Today we're going to go over the spine, its anatomy, and the degenerative pathologies that affect the spine. We'll watch a video called Contributing Factors of Low Back Pain. We'll go over injury and prevention, and then we'll wrap up our training with common treatments ranging from most conservative to least conservative. The spine is composed of vertebral bones and intervertebral discs that act as shock absorbers. The spinal column houses the spinal cord and protects the nerve roots as the nerves exit the spine. The spine is made up of 3 sections. The cervical spine is the top 7 bones. The thoracic spine is the middle 12 bones. The lumbar spine is the bottom 5 bones. And at the very base of the spine, we have the sacrum, which is the triangular bone that connects to the pelvic bones. In the picture on the right, you can see a healthy spine. You have a well-maintained disc structure. It's well hydrated. There's no degeneration or overgrowth of the facet joints. And there's plenty of space for the nerves and the spinal cord. The first pathology I want to talk about is spondylosis and degenerative disc disease. This is caused by osteoarthritis of the spine. It usually develops with age and is the result of normal wear and tear of the bones of the spine. It's frequently seen in the cervical and lumbar areas where you see the most motion. Symptoms are often asymptomatic. You may experience some crepitus, which is a crunching sound in the joints, a limited range of motion, and in more advanced cases, pain, tingling, numbness can result from a nerve being compressed due to bony overgrowth. The next one is going to be a herniated disc. This is when the gelatinous material inside the disc leaks out of a tear in the fibrous outer portion of the disc and presses on the nerve or the spinal cord. Symptoms are going to be pain in the extremities, especially when the spine is bent forward. You may have numbness and tingling in the extremities and a reduction in reflexes and weakness as the disease progresses. Next, we're going to look at spondylolisthesis. This is when a vertebrae slides forward onto the vertebrae below. It's categorized in grades 1 through 5, with grades 1 and 2 being treated symptomatically, grades 3 and 4, usually requiring surgical intervention, and grade 5, which is a complete slip. Many of these are asymptomatic, but when they do cause symptoms, the patient will experience back pain, pain while walking, in male patients, testicular pain, and with more progressive disease, loss of balance. Next, we look at spinal stenosis. This is caused by the narrowing of the spinal canal. It can be congenital or acquired, which is more common, associated with trauma or arthritis, and most commonly occurs in the cervical or lumbar areas where there is the most motion. Symptoms are going to include pain, numbness, and tingling. The last condition we're going to look at is myelopathy. This occurs when there's cord compression from bone spurs, disc herniations, rheumatoid arthritis, stenosis, or trauma. Symptoms include tingling or numbness, weakness, loss of dexterity, balance and gait issues, and pain or stiffness at the site. Myelopathy is considered an emergent condition which must be treated with surgery. Now we'll watch the video on the 5 contributing factors of back pain.
Welcome to my channel. Today we're looking at 5 factors that contribute to back pain. Improper lifting is a common cause for back pain. This occurs when you bend from the waist to lift objects, lift boxes above the chest level, twist to lift or carry an object, or are in poor physical shape. Poor posture puts pressure on the discs in the spine and causes muscle tension and fatigue. Make sure you have a work environment that allows you to sit or stand with good posture and wear shoes that are right for your activity. Excessive weight puts stress on the discs and joints in the spine. Contributing factors include poor sleep, lack of physical activity, and eating sugary and processed foods. Activities that cause strenuous, repetitive motion can cause wear and tear on the joints, discs, and muscles supporting the spine. The activities include, but are not limited to, weightlifting, gymnastics, contact sports, and golfing. A lesser-known factor of back pain is the use of nicotine-containing products such as cigarettes, cigars, chewing tobacco, and vaping. Nicotine reduces the blood flow to the spinal structures, leading to disc deterioration and osteoporosis. Produced and edited by Jamie Writing. Video by Gifting.com, Bluebird, Ivan Samkov, Artem Podres, Gustavo Fring, Mark Production, Tima Miroshnichenko, and Cotton Bro. Music by 2 Tech Audio, created using Canva, Audacity, Pexels.com, and FreeStockMusic.com. For more videos like this, like and subscribe. Thank you for watching.
Now we'll look at injury and prevention. When looking at injuries of the spine, we have 4 mechanisms of injury. The first one is hyperextension injury, which occurs when the spine is overextended, resulting in fractures and dislocations of posterior elements. This is most common in the cervical region. The next is flexion injury, which is the opposite of hyperextension injury, which is caused when the cervical region is overflexed or has a sudden and excessive force to one side. This results in fracture or dislocation of vertebral bodies, discs, and ligaments, and is most common in the cervical area. The third is axial compression injury. This occurs when there is a force straight down from the cranium through the vertebral bodies, resulting in shattering fractures. It is most common in T12 through L2. And the last mechanism of injury is flexion rotation injury. This occurs when the head is turned in an opposite direction from the torso. It results in the rupturing of support ligaments and fractures, most common in the cervical area. Now we'll look at the spinal cord injuries. You have cord concussion and cord contusion, both of which are temporary conditions. Cord compression, as we see in myelopathy, can be temporary, but can also cause permanent damage if not treated. Laceration can be reversible if the damage is slight, but is permanent if the spinal tracts are disrupted. Hemorrhage is the bleeding into the neural tissues as a result of blood vessel damage, and usually has no major loss of function associated. Damage or obstruction of the spinal blood supply will cause permanent damage if blood supply is not returned in a timely manner. And the last 5 injuries all involve transection of the spinal cord. A complete transection will result in permanent loss below the injury level. An incomplete transection will result in loss of function below the injury. However, the intact function may compensate. Preserved sensation transection still has demonstrable sensation below the injury. Preserved motion non-functional transection shows motor function but with no purposeful use. Sensory function may or may not be preserved in this situation. Preserved motor function functional is when there is voluntary motor function that is functionally useful below the injury level. Along with spinal cord injuries, we see spinal shock. This is the loss of reflex function below the injury. This involves skeletal muscle, bowel and bladder, and sexual function, and autonomic control. Thermal control is lost due to the hypothalamus not being able to regulate body temperature via vasoconstriction and metabolic rate. Generally, this condition lasts 7 to 20 days. However, it can be shorter or longer. It terminates in the return of reflexes, hyperreflexia, spasticity, and reflex emptying of the bladder. Associated with this is autonomic hyperreflexia, which may occur after the spinal shock resolves. It's associated with massive, uncompensated cardiovascular response to stimulation of the sympathetic nervous system. It is life-threatening, and the symptoms consist of proximal hypertension, pounding headache, blurred vision, sweating above the level of the injury, nasal congestion, nausea, piloerection, and bradycardia. Here we'll look at the top 4 ways to prevent injury to your spine. The first one is driving safely. Motor vehicle accidents are one of the most common causes of spinal injuries. This can result from improperly wearing your seatbelt, not wearing a seatbelt, and airbag deployment. For children, they should be restrained in a safety seat that is age and weight appropriate and should sit in the back seat until at least the age of 12. Next consists of knowing the depth of water you are diving into. You should not dive into water that is less than 12 feet deep or in situations where you cannot tell the depth of the water. To prevent falls, you should use a step ladder with a grab bar to reach items that are above your head, using handrails on the stairways, and using non-slip mats on floors and in the tub and shower. For young children, use safety gates at the tops of stairs and window guards, especially when on the 2nd story or above. When playing contact sports, make sure to wear the proper equipment, and when playing any sport in general, never lead with your head. The last section that we'll cover is spine treatment. When it comes to treating spine pathologies, less is more is the best way to go. What do I mean by less is more? Less is more medicine aims to serve as an invitation to recognize the potential risks of overuse of medical care that may result in harm rather than better health. So when taking the less is more approach to spine care, we are looking at treating pathologies as conservatively as possible. To do this, we're going to start with medication treatment using NSAID medications. NSAID medications are medications such as ibuprofen, Advil, Motrin, and some of the prescription medications such as meloxicam or Celebrex. In conjunction with the use of these medications, physical therapy can help strengthen the muscles that support the spine structures, alleviate pain, improve range of motion, and help you formulate a plan to prevent recurrence of symptoms. When medication and physical therapy fail to alleviate your symptoms, advanced imaging would be the next step. MRIs allow us to see if there's a disc herniation or cord compression causing your symptoms. Once the imaging has been done, then a plan for treatment can be formulated, and this would include either injections or surgery. Here are listed 6 different types of injections. Epidural steroid injections, or ESIs, are when a steroid and anesthetic are injected into the epidural space in an attempt to alleviate the pain and inflammation, hopefully avoiding surgical intervention. Facet injections are similar to epidural steroid injections in that they contain a steroid and an anesthetic, but rather than putting them into the epidural space, the injection is placed into the facet joint to help alleviate inflammation caused by overuse of the facet joint. Selective nerve root blocks use only an anesthetic as a diagnostic to determine if the area being considered for treatment is the correct area. Sacroiliac joint injections are similar to facet and ESI injections in that it is a steroid and anesthetic placed into the joint space to help alleviate pain and inflammation. Medial branch blocks are a diagnostic tool used to determine if a radiofrequency ablation would be effective in relieving mechanical back pain. Trigger point injections are used to help muscle spasms resolve. When physical therapy medications and injections fail to alleviate the symptoms of back pain with radiculopathy into the extremities, surgery would be the next step. Much like everything else in spine health, you want to take a less is more approach. For disc herniations and spinal stenosis, the best option would be an endoscopic spine surgery if you are a good candidate for one. This involves using a camera and tools placed through a very small incision to clean out the disc material or bony material that is causing the symptoms. In using such a small technique, patients are able to regain function and return to their activities much sooner than traditional spine surgeries. Not all surgeries can be done endoscopically, though, but you should opt for a minimally invasive spine surgery that involves the smallest incision possible. In the case of a disc replacement or a spinal fusion, the best approach is to use a tube retractor that uses dilators to separate the muscle fibers in larger and larger amounts until a tube retractor, shown in the picture here, can be placed in between the muscle fibers that allows the tools and the implants to be passed through, and then the retractor can be removed with the muscle returning to its original position, allowing healing and function to return more quickly than traditional surgeries. This concludes my presentation on spine health, injury prevention, and treatment. The last thing that we're going to do before we wrap up for today is play a little game called Kahoot. It's a 7-question trivia questionnaire that can be played on your phone. So go ahead and get those phones out, get your camera ready, and I'm going to pull up the QR code for you to scan so that you can play along with us.